Hello, y'all. I'm just getting ready to try to take this banner off. How are y'all on this wonderful Monday? All right. So thank you all for joining. Today, I want to make this pretty quick. I'm not going to hold you guys long, but I just wanted to kind of emphasize on what doctor or what provider do you see for whatever issue that you may have. A lot of times people don't follow up, patients don't follow up because they're not clear on who to see. Or when to see them. So I'm going to just kind of highlight some things. Of course, if you have any specific questions about anything or anybody in particular, just let me know. Put it in the comments. Please put your name because sometimes I can't see who's commenting and I want to address you appropriately. Okay. Before the live, once I'm wrapping things up, I will type out these specialists because they are kind of hard to pronounce, but you'll be able to see them in the comments. Okay. So I tried to, and I'm just making some notes for myself, but I tried to go from head to toe. So anybody, or if anybody has any issues dealing with the brain, memory loss, dementia, anything to deal with the brain or spine, you want to see a neurologist. Okay. And again, I'll be typing these as we go along. Let's see. Most of the time, if you have a primary care provider, they can refer you to a neurologist. There are specialists, like nurse practitioner specialists who specialize in neurology. So every specialty that we discussed today, they do have other providers, such as like a nurse practitioner or a physician assistant. But the neurologist is going to be like your head doctor over that practice. Okay. So I'm going to type that down, neurologist here. This is for the brain and spine. All right. And okay, so moving on down, ear, nose, and throat doctor. Now, this is a hard one to pronounce, y'all. We always just say we're sending you to the ear, nose, and throat, but it's the otorhinolaryngologist. Okay, and again, I'll type that in. But if you're having any issues with your eyes, some people go for like bad allergies, difficulty hearing. Most of the time you'll start with the ear, nose, and throat doctor and you kind of go out to specific specialists after that, after they see you. But they're called, again, an otorhinolaryngologist. Okay. If you're having specific problems with your eyes, you would see an optometrist. And an ophthalmologist is one who does surgery on the eye. So an optometrist sees you for your like primary care for your eyes, and an ophthalmologist will do surgeries when you have difficulty. Like some people do like the laser surgeries, cataract removals. That's going to be your ophthalmologist. So I'm going to type those in here. Okay. And please let me know if you have any questions while I'm doing this here. Gynecologist. Okay. Okay, for your ears, an audiologist. Okay, that there are specialists for hearing loss. Some may have issues with, if you may have a child who's had tubes before, they typically see your ENT. But again, most people start with the ENT and then they will refer you out to the specific, like if you need to be seen specifically for your eyes, they'll send you to the optometrist, or for your ears, an audiologist. Okay. And audiologists are good again for hearing loss, hearing aids. You may know someone that has hearing aids. So moving on down, the chest, the heart area, you're going to see a cardiologist. Okay. Cardio is heart. So if you're having any difficulty with chest pain, shortness of breath, sharp pains that run through the arms, definitely want to see a cardiologist. Of course, if any of those symptoms are sudden, you want to make sure you're seen in an ER or urgent care. But especially if you've never been seen by one and have a history of heart problems, cardiology is where you need to go. And again, all of these specialists you can be referred to these specialists from your primary care. You can check with your insurance company. Some insurance companies don't require referrals anymore, which basically means you can Google a cardiologist in your area and make an appointment straight through them without having to go through your primary care. I know a lot of times primary care, they're the ones that actually draw blood and kind of get you worked up before you see a specialist. So it's always good to kind of double check those things. So if you don't have a primary care, it may be good to go ahead and establish one or find one, especially if you know you need to be seen outside or you want to be seen somewhere else. But again, heart, chest area, heart palpitations, make sure you see a cardiologist, okay? If you've had a heart attack in the past or know someone that's had a heart attack in the past, ask them, when's the last time you've seen your cardiologist? And you should, if you have any heart event, you should always keep following up with the cardiologist despite feeling good, feeling fine. You want to make sure you keep those annual or every year appointments just to make sure everything looks good, okay? All right, moving on down to the stomach. That's a gastroenterologist. That is a person who is they can help with acid reflux. Some do those bariatric weight loss surgeries, but anything dealing with the stomach or the intestines, that's going to be your gastroenterologist or your GI doctor. You may have heard it as a GI specialist. Again, all of these areas have nurse practitioners or physician assistants who work in that area, but if you just want to Google a practice, it would be gastroenterologist, okay? Like I said, I'm just typing these. All right. Moving down, for female issues, you're going to see a gynecologist, okay? A gynecologist. We typically call them for short OBGYN. But OB is for carrying children, obstetrics, but the gynecologist would be for your routine female checkups. For men, a urologist, they are the ones that you see for your any male issues. And also for everybody, urologist deal with urine. So if you have any difficulty holding your bladder or any burning sensation, things that are abnormal, a urologist is one to check for the urine flow, and they also deal with male issues such as prostate, maybe prostate cancer or enlarged prostates, those having difficulty with their streams, which is just urinary hesitancy, meaning you think you gotta go, but you can't quite go right away, or going too much or not enough. That's going to be your urologist, okay? So we're going to type that down in here. All right, urologist. Thank y'all for being patient with me. All right, moving on down. Moving down to the feet. A foot doctor is also called a podiatrist. Okay, so if you're needing someone to look at your feet, some people have achiness in the arch of their feet. Some people have, like, I guess, the Achilles tendon in the back. Just usually people go to these specialists for foot pain. So if you're having issues with your feet, bunions, the little nodule on the big toe or hammer toe or anything abnormal with your toes, podiatry is the specialty you need to go to. Okay, so again, this doctor is called a podiatrist. All right, let's type this up. Okay, moving on down. So overall joint pain, your hips, arms, shoulders, just joint pain in general. Joints are everywhere. You want to see an orthopedist. Okay. A lot of times, like I think you might have heard of more orthopedics. You definitely want to see one of those for joint pain. And then you can get as specific as a rheumatologist if you're having issues with like an autoimmune disorder called like rheumatoid arthritis. Again, you kind of start with one specialty and then they'll refer you out if more blood work or more exams are needed. But for the start, An orthopedist is who you need to see for your joint pain or joint problems. We do have now, there's a lot of pain specialists, if you will. Some people who have generalized pain, you can see a pain specialist. They do exist. So again, if you have an issue kind of knowing where to start, you can Google one and call and say, hey, do I need a referral? If you do, you need to go and contact a primary care provider who can write that referral for you. Again, and also checking with your insurance company. If you have insurance, check with them to make sure that they pay. If a referral isn't required, check with your insurance company, make sure they're going to pay for that visit. Okay. I think specialists tend to charge a little bit more. Those copays are a little bit higher for a specialist than they are for your primary care provider. Okay. All right. Let's add this. Also, along with the joint pain for the orthopedist, broken bones, that's typically who you would see for that as well. But most of the time, if you're breaking something, you're going through the ER or the urgent care. So they'll tell you need to follow up with, okay? Let's see what else. Dermatology is skin. Anybody have any issues with skin? This is from eczema to psoriasis to what we call allergic dermatitis, just simply allergies on the skin. Contact dermatitis, atopic dermatitis, these are just fancy names for skin conditions. But a dermatologist is one you would like to see for skin and also hair loss. They do deal with hair loss as well. Let's see, let me type this in here. Does anybody have any questions? Yes, new moles too. They will see you for abnormal moles that pop up. Some people have to be very careful, especially if you do a lot of sunbathing. Some areas that are of the skin that come up are just random. They do need to be screened for cancer. Some people are at risk for skin cancer. So you definitely want to see a dermatologist to rule out any issues with cancer. Okay. And let me type that in here. There are weight loss specialists out there. You don't necessarily have to go straight through your PCP or your primary care provider to lose weight, but there are weight loss specialists. Not quite sure, honestly, if they have a specific name. I do know they just kind of specialize in that area. Your pediatricians are going to be your a doctor for children. And there's also pediatric nurse practitioners, pediatric physician assistants, but just overall, pediatrics just means children. Okay. You hear that name, like, what is that? It just means kids. Gerontologists, those are for your elderly patients. I believe the age is 65 and older. So patients typically in your nursing home, 65 and older, we categorize them in like adult gerontology. So if you just see those names or hear those names, don't be alarmed. It's just a fancy name for elderly. And let's see, general surgeon, that is a specialty. So some people who, I'm trying to think of an example. Okay, so some people who end up getting their thyroid taken out, they maybe referred to a general surgeon to have that removed. So you can be seen, like some people have like abnormal, I'm trying to think of the word, excuse me. Like if you have like a mass or something that they end up saying, hey, it's nothing, it's benign. That's the word meaning. Benign basically means it's not cancerous. So you have like a nodule or something on your arm, they will refer you to a general surgeon to have that removed. Okay. So that is also a specialist, if you will. And I'm trying to see, I think I've kind of hit everything I wanted to talk about today as far as who to see. Oh, your diabetes specialist. They're called endocrinologists. If you're somebody that's having uncontrolled diabetes and your primary care provider can't seem to get you on track and get you to stay on track, they may refer you to a endocrinologist. Okay, they specialize in diabetes. Okay, rheumatologists, they specialize in autoimmune disorders such as lupus is one. I could talk about rheumatoid arthritis is another autoimmune issue, and that's pretty much basically when your cells start eating one another and it attacks the body, basically. We'll have to go into that another day. But I hope everything is flowing well. It looks like my screen is trying to do something funny. I hope that y'all can hear me well. I'm going to scroll through the comments to see if I've seen any Any comments here? Let me add endocrinologist. Diabetes specialist. And I think pediatrician. Behavioral therapists. I'm sorry, I'm just now thinking behavioral therapists are people you may see for counseling for mental illnesses. Psychologist. They can also counsel you as well, but it's the psychiatrist that can write medications for you. So there is a difference between the psychologist and the psychiatrist. And then there's also the specialist psychiatric nurse practitioner, which I am currently in school for. But yes, those are for mental health illnesses. Okay. Children's specialists. Again, I'm just bear with me. If y'all have questions, please type them. I'm just trying to make sure y'all get everything in these comments. All right, specialist. You're a therapist. Psychologist and psychiatrist. They're all for mental health. Okay. Do you guys have any questions? Scroll up here. Someone said cool one. I'm not sure. I'm sorry. I'm just now seeing it. I think that's it. No new comments. So, well, I hope this was beneficial for you. Again, you guys can always connect with me. My website is down below. You can email me if you have any specific questions. I'll do my best to answer them. This video is not to diagnose or treat anybody. This is just simply information that I want to get to you guys because health is wealth. The more you know, the better you can do. Again, it's good to have a primary care provider so that you can get to these specialists if you need to. But always check with your insurance company to see how they're reimbursing for specialists. And because you don't want to be blindsided, but I do recommend you still see a specialist if you need one, but just kind of know up front what what you're getting into. So good luck to all of you, and I wish all of you the best. And y'all enjoy the rest of your Monday. Thanks, Ebony girl. Hey. All right, y'all take care and good luck.